Hello, so I'm Jane Graham. I'm one of the haematology consultants at Royal Stoke, and I'd like to welcome you to session 1 of your Year 5 transfusion training. So in Year 4, we focused a lot on the practical aspects of transfusion. So, you know, what temperature it's stored at, how you administer it, acute transfusion reactions, whereas in Year 5 what we're going to do is focus much more on your clinical decision making. So who needs a blood transfusion, for what reason, and we're going to focus our first session on red blood cells, so specifically looking at patient blood management, PBM, how to identify anemia, treat it and transfuse, and then in session 2 we'll look at the plasma products, so that will be your platelets and your FFP. So patient blood management it is a global phenomenon that's been around for like over 10 years, and in theory there are these 3 pillars of patient blood management which are best remembered by the elephant, the bear and the tree. So your elephant stands for optimizing or maximizing erythropoiesis. So this is about identifying anemia and doing something about it. Your bear is minimize bleeding. So this is making sure people have got anticoagulation management plans. If they're on an anticoagulant, it's giving people tranexamic acid to minimize bleeding. And then we've got the tree, which stands for optimized tolerance. And that's about making sure people are well oxygenated. It's about giving people single unit transfusions as a treatment decision and re-evaluating them. It's about thinking of other stuff like cell salvage, etc. And the reason we care about anemia so much is because, as you can see from this meta-analysis, it makes a massive difference in surgery if you are anemic or not. So this diagram shows us that basically those people who are anemic are more likely to have a blood transfusion, obvious, but actually you're more likely to die. You have worse morbidity, particularly the kidney damage, stroke and infection, and the cardiac studies show that you stay in hospital for longer. So if someone is anemic before surgery, you want to do something about it. The other important thing to flag is the cut-offs we have of 130 for men, 120 for women. And actually you can see here from this graph that the worse your anemia is on the left-hand side, the more likely you are to die. So the worse, the worse. But actually what's interesting is as you come up, you know, the men and the women are pretty similar. And so actually there is no reason why we should be aiming for a lesser hemoglobin in women, and both men and women you should be aiming for a hemoglobin about above 130 to minimize any complications before their surgery. When we're thinking about the tree, the key messages you need to do is this is our NHS blood and transplant, so don't give 2 without review. I'm less keen on this. It's a bit like saying to a child, don't go near the fire, and all they hear is the word near the fire. So it's ours, it's not great. This is the Australian one, stay single, which is obviously a much more positive command. That's better. But this is the German face of patient blood management, which I must get rid of because it's so inappropriate. But be appropriate and stay single would be my catchphrase. And his pants say patient blood management, wir sind dabei. We are on board. So the Germans are fully on board. So the way we're going to do our transfusion training is this concept called team-based learning. So team-based learning is an educational methodology that focuses on cooperative learning. So essentially you are stronger together. It's quite a formal process, so you get this pre-course material that you need to study on your own. Then when you come to the session, we assess your individual knowledge of that material, and then you work together as a group to answer the same multiple choice questions, but together so that you can learn from each other. What we do then is come together and have a discussion with a contents expert, that's me, where obviously we can discuss those issues in more detail. And then what you do is you apply your knowledge to real life scenarios. and make specific decisions about what you're going to do. And again, we then come together and discuss it and argue why we would do X, why not Y. And obviously classically this works much better in a face-to-face environment, but we have worked things so that it works remotely as well. So in a moment I will we will share the links that you need, because the first thing you're going to need to do is answer the MCQs on your own. So IRAT, Individual Readiness Assurance Test. So you answer your 11 MCQs online. It's anonymous, but you should put your team number in, and you won't find out whether or not you've got it right. What you're then going to do is do your team readiness assurance test. So this means you are going to be answering the same questions that you've just done, although you will find these questions in the files documents on our channel, because the questions need to be in a particular order, the answers, and the other form tends to mix and match. What you then do is you work as a team, and you come to a group decision about what answer you're going to go for. What's important is that you don't just go, oh, I think it's A. You need to go, I think it's A because ... because I saw this patient, or I know it's not E because I know the commonest cause of something is it. So I want you to learn from each other and to consolidate your learning through effective discussion. And that will take you probably about half an hour. What Jenny's given you is these scratch cards. So when your team has decided that it's, say, answer C, you scratch off the silver box on answer C. And if there is a star there, you've got it right and you'll get 10 points for your team. If there's no star, then keep trying until you get the star. So the beauty of this is it's reinforcing positive learning, because you actually find out what the answer is. At the same time, I would like one person from the team to go online. We'll share a link so you can tell me how many points your team got for each question, because what that will help me do is when we're doing the discussion, it will let me know which questions we should focus a bit more time on. Normally we would then come together and have a chat, but we basically don't have much time and everything takes longer online. So what you then need to do is go and do your cases as a team. So there are 3 PDF documents on your Files tab, case ABC. What you need to do is work as a team and answer the questions as you go along. At the same time, one of you needs to log on to the TAP form. Again, we'll share the link, and I want you to enter your team answer for each question, because what we'll do when we meet up next week is obviously we'll go through those answers, and I'd like you guys to be able to defend your choices. So, you know, we decided to give 1 unit of blood to this woman because ... or we decided not to transfuse because ... So I'd like you to have a good think about those before we talk about them next week, because like most things in life, it's very obvious when someone tells you the answer, but actually as doctors you're going to need to make these decisions. So hopefully that's all clear. Jenny will have a document that's got it in black and white as well if you've got any more questions, and I look forward to meeting you next week. Take care.